I'm Ysrael Hernandez.
And I'm Soledad Jacot.
Today we're going to do a public service announcement on the disease meningitis.
Meningitis is the inflammation of the protective membranes covering the brain and spinal cord, collectively known as the meninges.
The inflammation may be caused by infection with viruses, bacteria, or other microorganisms, and less commonly by certain drugs.
Meningitis can be life-threatening because of the inflammation's proximity to the brain and spinal cord.
Bacterial meningitis is by far the most dangerous of the two. It can occur in everyone but is rare in everybody except for very small babies.
Viral meningitis gives similar but less severe symptoms, but of course cannot be treated with antibiotics. People usually get better on their own with their own proper rest and care.
This treatment causes changes in the cerebrospinal fluid, aka the CSF, that surrounds the brain and the spinal cord.
The severity of meningitis ranges from mild symptoms to death or permanent disability.
The symptoms include fever and chills, nausea and vomiting, severe headache, sensitivity to light, stiff neck, and mental status changes.
Those who are affected by this disease are mainly people with weakened immune systems, individuals who work with animals and residents of crowded facilities, such as dormitories or military bases, have a greater risk of contracting meningitis. Children younger than 5 years of age have a higher risk of getting viral meningitis.
In fact, people under the age of 25 are at a greater risk of developing bacterial meningitis. Unvaccinated teenagers have a high chance of developing meningitis. People who travel to countries often may be at risk of contracting meningitis.
In the United States, bacterial meningitis affects about 3 in 100,000 people each year, and viral meningitis affects about 10 in 100,000.
In most cases, approximately 70% of meningitis occur in children under the age of 5 or people over the age of 60.
Viral meningitis is milder and occurs more often in adults under the age of 30. This disease is more prevalent in people between the ages of 15 and 24 who have not been vaccinated.
Treatment varies depending on the type of meningitis.
Doctors prescribe antibiotics for bacterial meningitis. Viral meningitis that is caused by herpes virus may be treated with antiviral drugs, but most viral cases of this disease clear up on their own in 1 to 2 weeks.
Other medications and intravenous fluids will be used to treat symptoms such as brain swelling, shock, and seizures.
Some people may need to stay in the hospital, depending on the severity of their illness and the treatment needed.
Well, this concludes our message, and this public service announcement has been brought to you by Ysrael Hernandez.